A very good afternoon to everyone. Yes, it's almost going to be evening, just one more hour for 6 p.m. And that's the perfect day to end with a pleasant introduction, of course, with Copy with Vance. This is Vance here. Today is a very interesting topic and it's very close to my heart. Yes, it's very close to our heart. The topic that we are going to talk today, and the particular person that agreed to come on board and share his valuable experiences is just a true blessing. In the human mechanism, I think the whole body, I think this is a particular uh, part of an organ, I think is extremely very important. Without that particular organ, I think that's it. There's no life in the human life. So before I go on, I'm just going to tag. Just give me a couple of seconds. I'm going to share this video live. Write a post. Yes. All right. So I've tagged in. Thank you so much for tuning in. And I'm going to bring that particular person in. And yes, I'm not going to do the introduction. I'm just going to give that honor to him to do the introduction. And today with me is Dr. Dinesh Nair. Hello, doctor.
Hi, Vance. How are you?
I am good, sir. How are you, sir?
Good. And thanks for having me on today. This is quite interesting because it's become the new norm going online to do everything. I've always given talks in front of podiums and stuff like that. And now I have to learn how to do this and work the internet as well.
I'm just speechless because with your busy schedule, I know how it was because a couple of days back when we were having a call, within that call, you got disrupted so many times because so many cases coming up. You're always needed everywhere. So it's my true blessing and my humble request that you have come in, and I'm very truly blessed for that, doctor.
No, Vance, it's my honor to be on your show. I've actually watched a few of your episodes. Very interesting, and you give a very unique take on a lot of things as well. So I'm expecting you to throw a lot of hard questions my way, so I'm trying to get prepared for that.
Thank you so much, doctor. Before we can even start off, you don't need any introduction because you have came in radio channels and so many interviews. You have done so many seminars. But just for our viewers, I will get the pleasure to do an introduction, doctor.
Sure, of course. A lot of your viewers won't know who we are. So my name is Dinesh Nair. I'm a cardiologist. I'm Singaporean, of course, third generation, born and bred here. We've all been here for a few generations, worked overseas for a few years as well. And I think as a general introduction, I've been a doctor for about a quarter of a century, 25 years, sounds a bit better, and been in cardiology for well over 20 years as well. And we've been here in Mount Elizabeth, Orchard and Novena, primarily Novena now, for about 10 years in private practice. I was in the government practice some time ago. That included National Heart Center, Tan Tock Seng. But, as always, people go into private practice eventually, especially if you hit a certain age, I guess. So I'm happy. I go back and I help out at Tan Tock Seng Hospital, doing calls for emergency cases. And I'm what you call an interventional cardiologist. So there's different types of cardiologists. We have people who do the plumbing, the electrical stuff. Most of us do everything, of course. But some of us subspecialize. So my subspecialty is in the plumbing side of things. So I always tell my patients I'm a plumber. I look at the pump and the pipes. And if a pipe is choked, we open it up. And if something is open and needs to be closed, we close it up. So it's plumbing, in essence, among other things. But we look at all kinds of other stuff. We do screening of patients for heart disease. We try and treat the worried well, among other things. A lot of our patients walking through our doors, the worried well, worried about their heart condition. They hear about friends who've had a recent episode or recent heart attacks, and they come in asking to have an assessment, among other things. But I think the most gratifying thing that I do, and this is just a quick introduction, of course, is that when patients come in with a heart attack, we get the opportunity to save their lives. Heart attack is blockage, and I'll go into all that in a short while. Blockage of a heart artery that causes a heart attack, and it's often life-threatening. And I'm just thinking, 1 week ago, we had a guy who was 90 years old who walked into my clinic. Actually, he didn't walk. He came in a wheelchair into my clinic. But he's been a patient of mine for over 10 years, and he had a heart attack at the age of 90. And we were lucky enough to get in time to save his life, open it up with balloons and stents and stuff.
Wow.
So this is more or less what we do.
Thank you for the introduction, doctor. Truly, the human body is a beautiful mechanism that we're running, not only on the outer part, but the inner part, I think is very important. Me coming from the expertise of, aesthetic, right? Looking good, looking toned, but we also work on cardiovascular just to
Yeah,
keep the
of course.
heart stronger and kind of stuff. So it's going to be a very interesting topic talking to you today on the topic of heart matters. I think that is where your heart matters, right? I mean, is
Yes,
that the
yes.
okay? So you
We
want to
call
talk about that?
it heart matters. Um, uh, it's kind of funny because there's a bit of a joke at some point as well. People thought that we were a dating agency at some point. Heart matters. No, I'm kidding.
Okay,
No, but so we say we treat all matters of the heart,
okay. So
emotional, physical, otherwise.
okay, so that's a good one to know, that doctor. So doctor, I mean, if you look at it, I mean, for myself, I mean, the 2 decades of in the fitness industry, but over the past 6 years, I have changed it to very holistic, because I do believe the human performance is not just looking good and looking toned and firm or muscular, but it's also about all the organs in our body. So I think the today topic is, of course, basically about the heart. We do see a scary number that is happening since from 2016, or in fact beyond that younger generation also falls under the victim of heart conditions. So that's a bit scary. Usually when we say, you got a myocardial infarction, it's only after 50 or 60, that's common. But right now, it is happening like below 30. And is it because of stress, or is it because of hereditary, or is that something that it's happening to the beautiful body?
Yeah, so this is kind of interesting because nowadays you keep hearing about all these younger guys getting heart attacks. It may be true that we're starting to see this at an earlier point in time. The difference is we lived in a different age about 30, 40 years ago. When I was a kid in the 70s and the 80s, you didn't hear so much about it because we didn't have the information we have. We didn't have the connectivity that we have right now as well. And there were people getting heart problems in their 40s, their 30s, their 50s back then as well. But perhaps you didn't hear about it so much. Whereas now everything is readily available on the internet. If someone runs a marathon and collapses at the age of 25, you hear about it immediately as well. So there's a lot of things that play into this. The fact that we are probably living a more unhealthy lifestyle compared to our predecessors or people who lived 20, 30 years ago, pre-World War even. But then if you look at mortality back then, a lot of people didn't live beyond the age of 50 or 60. 50 or 60 was considered very old.
Yeah.
Nowadays, you tell someone you're 60 years old, they say 60 is the new 40, right? Because we're living to an older age. I mentioned the example of this patient of mine who's 90 years old who's come in. I've treated a couple of his friends who are 95 as well. And everyone lives, and there is a chance to live up to 100 these days as well. So what happens is we're seeing people living longer. We're hearing more about it. But we're also hearing about a lot of people getting it at a younger age. And what is happening is you're probably getting a better diagnosis now because of the advancements. Oops, I think we just lost you, Vance.
Nope, I'm here.
Oh, you're back. Okay. We're looking at new advances where we're detecting things a lot earlier as well. We're able to treat people a lot earlier. We're able to prolong life. And prolonging life is not all that you want to do. You want to prolong life with a good quality of life as you move forward. So, someone's writing in as well. I see that's what happens.
Yeah.
Okay. So what we have, okay, is a wide spectrum, okay, of ages and different types of heart disease that you can have. Heart attacks are what you hear about the most. And heart attacks are occlusion of an artery. So your heart is about like this, the size of your fist sitting in your chest, okay, if you can see it. And there's pumps, the heart pumps blood out, and there's pipes sitting on top. I'm putting my hand, there you go. And these pipes are arteries. If one of these pipes gets blocked off completely, you get a heart attack. But before they block off, there's usually cholesterol plaque, which is what this is. Cholesterol plaque building up on the inside and gradually getting bigger and then rupturing at some point, causing a heart attack. Now, a heart attack is complete occlusion of that artery. Partial occlusion can cause chest pains and shortness of breath, but sometimes people have no symptoms as well. So when we check patients nowadays, we have advancements, we have CT scans, we have so many other technologies that didn't exist back then. We're finding heart disease a lot earlier. And I think that's part of the equation as well. We're detecting it earlier, we're treating it earlier, people are living longer. We're finding out the cause of certain sudden cardiac deaths and people collapsing while they're playing football or otherwise. a lot earlier as well, because we have the technology to detect it. And of course, there is the fact that, we're living a more sedentary lifestyle, and people are getting more diseases at an earlier age, perhaps, but that's not the whole answer in itself. Now, I mentioned there's a wide spectrum of heart disease. I mentioned that I'm a plumber. There's the plumbing system of the heart. There's the electrical system of the heart as well. So sometimes what you get is a short circuit in the electrical conduction or in the electricity of the heart that regulates the pump. And when you have a problem with that, then it's a different thing from a heart attack. People collapse because the heart stops, perhaps because there's an abnormal signal of electricity in the heart muscle. I don't know if that makes it a bit clearer.
But
we can expand on that a bit more if you like.
But, I totally agree as well, because there is no one issue to find a bigger solution. But, it can be stress, it can be sedentary lifestyles, not lack of exercises, because I passed down from the generations. But then again, as we get evolved, as technology improves, as recent studies are done, every day is a new exploration. But, sometimes when we say a 27 years old guy as a MI, myocardial infarction, that gives a shock, because hey, that's a huge gap that's between from 27 to 50, 60. We expect that this kind of condition is supposed to be happen after 50, but now it's happening younger. Again, could be the stress environment that we are in? All of us are just working too long, and maybe the food that we eat, is that could be one of the reasons that contributing to this issue?
I mean, definitely. I mean, that plays a big part. We're not as healthy as we used to be. We're more sedentary nowadays. The food that we eat is a lot more processed. Definitely. We're more overweight than we used to be in the past. And I always tell people, they always say, oh, but doc, I'm very healthy. I eat very well. I watch my diet. And then I tell them, unless you can see your six-pack in the mirror when you get up in the morning, you're definitely overweight. Okay, so I'm definitely overweight. I don't know about you, but I can't see my six-pack in the mirror. But the problem is, in the old days, people lived a harder life. They didn't carry so much excess body weight. There wasn't so much fat. They didn't have all this great food that we have nowadays to eat. McDonald's didn't exist about 50 years ago. Well, at least not in Singapore. I remember the first McDonald's burger when it came in. So how we eat and what we eat has changed over time as well. And that's added to it to a large degree. So I'm in complete agreement with you. We've changed nature as it is. We were supposed to have been hunter-gatherers in the old days, eating mainly vegetarian, vegan type foods. And we moved on to other things along the way. We started frying our foods and all that kind of stuff. So things changed. That definitely plays a part. But genetics play a part too. The youngest patient I have, who had a bypass surgery. I'd like you to guess how old you think that guy was when he had his bypass surgery.
I'm not trying to...
20 years of age.
Wow.
And that's because this particular guy had a hereditary condition. And because of advancements in science, he's only 30 years now. He had his bypass at the age of 20. Okay, not by us, but in another place. And what he's got familial hypercholesterolemia. That means the cholesterol is high right from the get-go when they're born. They have a gene that doesn't allow you to get rid of the bad cholesterol or LDL. I can go into the mechanics of that and all that, but basically he's got a super high LDL from when he was a child. And he lived through his childhood with all this because of advancements in technology. And this has existed 50 years ago, 70 years ago probably as well, just that the babies at that time didn't live through it because they didn't have the technology at that time as well. So this guy had bypass surgery at the age of 20. That's really young. Okay, so I've other patients who've had heart attacks in their 20s, late 20s, early 20s as well, coming across. And the reason is no one used to check in the old days, and so we didn't really know as well. So my suggestion to everybody, and this is probably going to be a question that comes up at some point, is when do you start checking your cholesterol to know, what kind of changes you need to make in your lifestyle? Now, guidelines state that you should start doing it in your 20s, but in fact, there are also some strong data stating that you should probably do your first cholesterol check in your mid-teens to have an idea, to know what kind of lifestyle changes you need to make. And then once again in your 20s, and if it's high, then it needs to be addressed. Now, there's also a lot of noise in the internet stating that, or maybe cholesterol is not the cause of blocks.
Mm-hmm.
It's not the only cause, I agree, but it's the most important and biggest one. There's so many other factors: stress, high blood pressure, congenital problems where you're born with abnormal arteries to start with as well. Many people don't know that, and you can't detect that as a kid. You know, there are patients coming through and saying, "Oh, you mean I was born with my arteries going the wrong way?" And I say, "Yes, you have." So why didn't they detect that when I was a child? The reason is you don't have the technology to do that, first of all, when you're a kid. Secondly, you're not going to put a small boy through a CT scan of his heart arteries. So all these things play a part as well. But checking early allows you to detect problems early and preempt things.
Totally. I totally agree as well, doctor. Because even I myself in the fitness industry for about 20 over years, it's always one thing that's always goes in my mind that I am handling a human life for that 1 hour or 40 minutes or whatever that. So I got to take all kind of precaution, make sure that he doesn't get a fracture, he doesn't collapse, make sure. So always there's a pre-medical screening they got to go. Some Q&A they have to ask. We have to ask them and they have to declare. But of course, it's an indemnity form they have to sign. But that doesn't mean that you can do anything to him, right? So
No.
when we see some risk factors going high up, like he smokes and he's unhealthy lifestyles and he doesn't control the food, then we know that it's a bit scary just by words. So you better go and see a dog, get it, check it out, and then come back to us. In that manner, I think there is a gradual improvements in the health, in the fitness as well. So we don't want to take anything too much of risk. We have a viewer that asked us. I'm going to pop in over here. He said, "Or not sleeping affect the heart?" Which
Yes, definitely. Lack of sleep, because your body needs to rest. It functions. It's supposedly this well-oiled machine. Okay. And like every machine, okay, if you overuse it, it starts having problems. So you need to get enough sleep. And lack of sleep has been identified as a major risk factor for getting heart disease, heart attacks, sudden cardiac death, strokes, lots of other diseases as well. So as human beings, we're supposed to be able to get at least 7 hours of sleep. If you got more, it'd be even better. Many of us can function on 2 or 3 hours and pride ourselves on it. People like me, last night, to go in 3 times, I only slept about 4 hours for a patient. Now, that's not good for my heart. It's good for the patient whose life I've saved, hopefully, but not very good for mine. But we are supposed to get a good night's sleep. And if you don't, then it throws everything out of whack. And that's when the risks go up. There's different types of stress. There's emotional, there's mental stress, but there's also physical stress if you don't sleep.
Could I say that, doctor? With the current condition of COVID and the current, every day is pretty much. I don't want to use the word challenges or struggles, but for certain, who have to do double jobs, like morning shift, night shift, they work so hard for the family. Sometimes they don't do these basic self-care, or even if they want to do this basic self-care, probably the financial might not be. So it's always a constant pressure. So when they put so much of pressure in the younger age, which is like the 20s and the 30s and the 40s, then probably the answers comes back in the age of 50s and 60s. But nowadays it's even coming earlier and earlier. We have another viewer that has also asked us, is heart failure and heart attack similar?
Yeah, so there's often this confusion between the two. And it's very interesting because certain articles that have even come out in the New York Times have gotten this terminology wrong. I'm not saying anything against the New York Times. Don't sue me. I'm just saying certain reputable newspapers, it's happened as well. So heart failure, okay, is exactly what it states. It's failure of the heart to pump. I'm trying to get my hand to the center of the screen. This is the pump of the heart. So it fails to pump adequately, okay? A heart attack, it's a different thing altogether. But heart attacks can lead to heart failure. So once again, we have this analogy, okay, of the heart and arteries, which are like this, okay, sitting on top. If one of these arteries gets blocked off, you get lack of blood supply going to the heart muscle. That's a heart attack, right? You have different types of heart attacks. You have smaller ones and bigger ones. A big one where a big artery gets knocked out 100%, that whole part of the heart muscle doesn't function anymore. And if that part of the heart muscle is not saved, let's say with what we do, angiograms, angioplasty, balloon, stent to open it up in time, what happens is you get death of that part of the heart muscle. When that part of the heart muscle dies, what you have is that part of the muscle can't move anymore. And if it can't move anymore, what you have is a failure to pump, right? It doesn't pump hard enough to pump the blood forward through all the arteries. So normally your heart pumps out about 55 to 60% of the blood each cycle. So if for some reason this hits it so hard that it drops to half, so let's take the number 60, and your pump is only 30% of the blood coming out. In time, it is like a sink where the water can't go through and it starts to well up and well backwards. And when that water wells backwards like a sink, okay, that where the blood can't flow through, what you have is you've got water accumulating or congestion. You heard of people saying water in the lungs, right? They say, this guy is not pump is no good. There's water in the lungs. And that's because that patient is heart failure of the heart to pump blood forward into all the other arteries that need it, and including up to the brain as well. So heart failure is failure of the heart to pump. A heart attack is blockage of a heart artery. But blockage of a heart artery can lead to heart failure when that heart muscle is damaged. I hope that makes it clear. But this is always a problem because people read up on this, and there's a lot of misinformation out there, sometimes even on the internet, and there's a lot of confusion as a result. That was a very good question.
Thank you, Doctor. I mean, said it so beautifully, the easy understanding. We have Harish saying thanks to us for earlier addressing the topic of sleeping. So thank you, Harish. Thank you for that. Doctor, I mean, for myself, I mean, we do say, certain groups of states, okay, let's talk about, as an Indian, there's a high risk, or Chinese is a lesser risk. We don't want to mention that, but it seems like in the community, there's a lot of Indians with a little high. Is it because of our food? One of the factor, but is it something that we can relate to or push it to the food? Is it because the food that is what we are getting, and we are exercising? You can see a lot of people are now starting to exercise, taking health as a priority, but is it because of the food?
Yeah, so Singapore is a very interesting place because what you have is you've got several races living together, almost living the same lifestyle. So we've been involved with studies from years ago. And one of them we were involved with in publishing as well was about 15 years ago, where we published that Indians had 3 times higher risk of having a heart attack than a Chinese person. And that was about 15 years ago. And the Malays had a 2 times higher risk. And then the subsequent studies that came back, these numbers started to change a little bit as well. So the Indians started having like a 2 times higher risk compared to the Chinese, because more Indians realized that they were getting heart disease and they were getting fitter. They were starting to exercise, because in the old days, most people didn't do that much. And I'm at old days, we're talking about 10, 15 years ago as well. So certain subsections of the population started exercising a bit more, started watching their diet a bit more. There's a crossover in terms of food as well, because everybody's eating each other's food as well. And so then you start seeing these numbers start to change. But it is still a fact that the Indians tend to have a 2 to 3 times higher risk of having heart attacks, okay, and heart disease compared to the Chinese. But a lot of Chinese are now eating Indian food as well. Indians are now eating Chinese food. And what you have is you have a mix. Now, changes don't occur always in one lifetime. What are your genetics? Your genetics are the practices of your forefathers for several generations, which then become part of your makeup and therefore your risk profile. Okay, so if you've got 1,000 years of bad habits, you can't undo it in one generation. I'm not saying we have for sure, but let's say a few hundred years. So that's when things start to change. And it is true. The food that we eat, the more fat, the more sugar there is in the food. And we're talking about unprocessed sugar and processed sugar, the works. Sugar is sugar, fat's fat. And you have all these articles being published about this type of fat and that type of fat. And it's very difficult to figure it out because the data keeps changing, right? Every day there's like 100 articles coming your way. But if you cut down, in general, fat and oil, in general, sugar and carbs, and try and eat more healthy, more in terms of vegetables and all that kind of stuff, you reduce your risk. So certain groups in society had less healthy lifestyles, less healthy food, and unfortunately us Indians tended to have the more oily and unhealthy food for several generations. But you're seeing that that's starting to change now as well. And that's why you see a change in the numbers.
Thank you, Doctor. I mean, for that, addressing that. Jay Kumar also said, thanks, Dr. Dinesh, for the explanation.
Thank you for asking all the questions, guys.
We have another question that someone has posted. This particular person, I know him. Personally, I know him because he was one of my colleagues in the gym that we operated before. And he actually practiced twice CPR. So he actually asked us this question: if someone is really fit, is there a chance that you wouldn't be showing symptoms if there is a blockage as the pump is stronger?
Okay, so actually, that's a very good question. Sasi, yes? I see the name up there. Yeah, so I can tell you a story about a patient of mine later on who actually runs marathons, but who's got 100% and a 90% block and didn't know until his marathon times started to drop. So an apparently very fit-looking individual who's, you always think you're fit and healthy, and this guy has washboard abdominals. You can see the veins on his abs. Okay, Chinese guy, my age, early 50s. Okay, and he actually had 100% block in one artery and a 90% in another. And the only reason we really found out was he felt his marathon times were a bit down, and he did a routine ECG that showed a change. But until then, he never thought of doing these tests. Okay, so an apparently healthy person can have blocks. And you don't usually manifest with symptoms of the block unless your blockage is more than 70%. And very often, even at 70%, you may not get symptoms because what you do is you train your heart to compensate for it. And what you do is you build these small little collaterals, small arteries that come out that compensate for it. But they can only hold for so long. And you see, and then the problem is at some point, even these very fit guys may end up with 100% block as well. So can a fit guy have blocks? Yes. Can someone who looks really strong have blocks? Yes. Can you train your heart to overcome it? Yes, up to a point, but not completely. And exercise and diet, contrary to popular belief and even medication, cannot remove a block once it's already there. So once you've already got a block there, it's like concrete that you've poured down into a pipe. It's sitting in there. It can't be taken out. Now, people always ask me this question as well. It's, we can pour acid down and take it out. You can't do that to your arteries, of course, because nobody wants to inject acid into an artery for sure. No bleach into your veins, as someone recommended very recently. Nothing like that, okay, because it's a bad idea, all right, from the beginning. And you can't, and it doesn't go away. So people are always under the impression you take medication, your blocks go away. You can't. But what you do is you prevent them getting bigger. So a fit guy can have a block 50% and continue being a fit guy. If he finds a block, he goes on medication to prevent that block getting bigger, exercises and diets, and can continue without ever having to have that block fixed as well.
Thank you, Doctor. Thank you for addressing that particular question for us. This gentleman, I know he has performed 2 times of CPR on site. One was on a treadmill. He came down and then he collapsed, so he tried to save, but unfortunately he couldn't.
Tried to save. Yeah,
and another one was also quite some time back because we were all working in the same environment. So people tend to exercise and then tend to get into a little bit of issues, and then we try to start up. So, Doctor, as we go in deeper, we understand that it can happen to anyone. With so many symptoms and so many issues that's going around, your sleep or your food or your exercises, or even when we talk about forefathers, it's passed down. Is what has happened back then is what is going right now.
A knock-on effect.
Yeah. So what is the sign and symptoms like discomfort, Just a second, doctor. I need to show you this. He said, "Brilliant answer. Thank you."
No. Thank you, Sasi. Thank you for the question.
So now, doctor, is there a sign or symptom? I mean, any signs and symptoms
Yeah.
like universal sign? I got a head pain or shoulder pain, but that will be too late. But is there something like an indication?
Yeah. So there are some indications. I mean, and sadly, more than 50% of the time, you will have no symptoms when you've got blocks. The data, and it's quite scary when you actually start looking into it, because one of the things you find is that 50% of heart attacks are silent. How did they find that out? There was a study where they took a whole bunch of people and just scanned their hearts looking for signs of heart attack having occurred. 50% of them never had a symptom or didn't know they had a symptom, may have thought they were just breathless on that day, had a little bit of a bad day when they were out running, something like that. So 50% of heart attacks are silent. If you look this up online, silent heart attacks, you'll see that there's a 50% figure. Now, the majority of heart attacks also don't occur, okay? Or rather, okay, let's rephrase that. 50% of heart attacks also occur with blocks less than 50%, meaning what you have is a 50% block that doesn't cause you any symptoms, and suddenly that plaque, which narrows, so you see this artery, it gets narrowed with plaque, right? That plaque suddenly ruptures for whatever reason. Stress, major precipitant. Physical, emotional, mental. More often than not physical though. Stress, that plaque ruptures, it occludes the artery. It doesn't mean that only big blocks cause heart attacks. So small blocks can as well. So then how do you find out? Okay, you can do certain tests. You can go for screening. If you do a basic screen, which is an ECG, more often than not, you'll find nothing. This guy who was 50 years old that I mentioned, the guy who runs marathons, patient of mine, if you're listening to this, you'll know who I'm talking about. I'll never mention names, okay? He found out because he had a change on his ECG. But most people don't. You can have 90%, 99%, 100% blocks without changes on your ECG. So then you think about what are the other tests we do? All of us have done the army, a lot of us have in Singapore, and they do a treadmill test when you clear 40. You go to a doctor's office and you do treadmill tests for screening. But treadmill tests are only 70% accurate as well. 70% accurate for a 70% block. A treadmill will never pick up a 50% block. It cannot pick up a smaller block. Okay, now if you do your maths, 70%, 0.7 by 0.7 is 0.49. So you got a 50% pickup rate doing a treadmill. So once again, the 50% rule, 50% of the time you won't be able to find out. So what tests can you do? Okay, you can't mandate that everybody in the population gets a CT scan from an early age. But the quickest, fastest way, and this is something that's being seen more and more in the guidelines, that you do a CT scan, your heart arteries, you find blocks early. If your blocks are not big and they're not causing symptoms, you just go on a tablet, change your lifestyle, and you have to take tablets for life because once you've got cholesterol blocks, nothing else can slow it down as much as a cholesterol tablet. And there's several different types of those as well. Then you go on that, and then what you do is you minimize your risk thereafter. So what are the signs? Okay, I know I've gone a long circuitous route. What are the signs? Chest pain, chest discomfort, the classic thing that you see when you look it up online, or the stuff that you see in the movies where the guy clutches his chest and he feels pain going down his arm. That happens less than 50% of the time. In fact, that probably happens even less than 40% of the time because 50% of people, once again, and it's a 50% rule, okay, who have symptoms have atypical symptoms, non-typical symptoms. So women, older people with diabetes, diabetics have a problem with the nerves in their body. They may not get the chest pain or the tightness in the chest that you're talking about. What they may get is what feels like gastritis, epigastric pain, reflux type symptoms, pain going to your shoulder tip, pain in the arm. Sometimes there are people who thought they've torn their biceps doing workouts and stuff, and it's persisted and turned out to be a heart attack. The strangest one I had was a lady who went into the A&E department after having been to 3 dentists with what she thought was toothache or jaw ache. The third dentist that she went to said, look, something's not right here. Your teeth don't look fine. I suggest you go to the A&E and get an ECG, because this time her toothache was really, really bad. She's a lady in her 40s. I remember her very well. The first two dentists, she had milder pain. By the time she hit the third dentist with the jaw ache, he said, I think you better go to A&E. And she went in there. The ECG showed she was having a heart attack. We took her in. We did an angiogram where we passed a catheter in. We inject contrast inside. And she had a block in the right coronary artery that we fixed. So there's a conundrum. There's a whole series of potential or possible symptoms. 50% of people get it. And among the symptoms, more than 50% of people get abnormal or atypical symptoms. So the classic chest pain occurs very rarely, unfortunately. And when it does, though, then you're having a massive heart attack most of the time.
That was also a very in-depth, doctor. I mean, it seems like, a very interesting topic, because we got a constant flow of questions coming in, and it's like, it's for those who really put their health into the first priority, I think they will enjoy listening, and that's what's happening to our viewers. For normal, from the age of 25 or even for the age of 20, yearly medical checkup, it is required, or do you think, or 6 months once is enough?
So I think it depends on the patient profile. And there's a lot of factors that come into play when you look at someone's profile. You have people who are very worried, who want to check up more often. You have those who don't want to as well. That plays a part. The age of the person, the race, okay? Because we did mention that there's some races that have more heart disease. Your risk factors, family history, all these things play a part. So there's no one system for everybody. But if I were to try and summarize it for you, I would say that everybody should have one blood test. And a blood test is simple, unless you hate needles, of course. A blood test in your mid-teens, male or female, just to know where you stand. And then one more in your 20s, just to know where you stand. And then after that, it's a question of when you need to do regular checkups. Perhaps from your mid-20s onwards is a good time, unless you find something abnormal at an early point in time, like a few of the patients I mentioned to you as well. For men, there are guidelines out there stating that you should always have checks at least from the age of 35 onwards. For ladies, from 40 onwards. Ladies, when they cross 50, lose some of the protective effects of estrogen. So there's a catch-up phase with men, because ladies tend to have a lower chance of heart disease at a younger age. But then they have a catch-up phase after they hit menopause. Okay, a 10-year span, by which time they've caught up with the men as well by the time you hit about 60 years of age very often. So when do you do your tests? First of all, you need to see the right person, get the first and proper evaluation done, and then if you trust your doctor, and you should most of the time, yes, trust your doctor to make the assessment as to how often you need to do it. Now, doing a yearly blood test after the age of 35, I think is not a big deal for most people, okay? But then economics come into play as well, because if you have to keep paying for tests as you move on, some people are reluctant to do that. So I understand. So that also comes into play. But doing a yearly blood test above the age of 35 for your cholesterol is simple. But then when do you do heart checks? When your risk factors are higher, when you've done an assessment, when someone like me perhaps sees the patient and makes an assessment of their risk and say, you're at a slightly higher risk, then we do more frequent checks. Some people, if they've done a check, I'll tell them, look, come back in 5 years. I think you're okay. Some people, I'll say, look, I think you need to come back in about a year, because we need to know a bit more about your situation in a year's time, after you've lost that weight, after you've got your cholesterol under control. And there's some I may say, come back in 6 months' time. So it depends on the particular profile. And then what tests do you do at that point in time? If you've had a CT scan that shows 50% blocks, you have no symptoms, and you were one of these patients who decide, oh, you know what, I just want to go and have a look, and you found out, that actually changes everything, because now you've got a 50% block. You're on medication. We need to see what happens when you start the medication, what your cholesterol levels are like, and their targets based on your overall profile. The same target doesn't apply to everybody for the bad cholesterol or LDL level. It depends on your risk factors. Okay, it depends on your overall profile. So then when you need to get that checked, perhaps in 3 months, then in 6 months, and then once everything is stable, you can probably go back to a once a year. So how often do you need to have your checks? That depends on the individual, depends on the assessment made by the doctor, and depends, okay, to a large degree, okay, on the findings, whether there are blocks, whether there aren't, what other issues you might have, because not everybody has blocked in the heart arteries. Some people have got abnormal heart rhythm problems, and those need to be addressed as well, and maybe they need to be seen more often. Now, for a fit, healthy individual like a young man like yourself, okay, perhaps a yearly test is the minimum you need to do, because I think you're above 40 now. Yes?
Doctor, I'm going to get you a coffee.
Yes.
I'm
So,
42.
yes. So then a male above the age of 40, every year some sort of test is a good idea. That way you prevent problems happening long term. I hope that answers your question to some degree.
I mean, doctor, seriously, I mean, this is I don't know how to say that. This is more like a seminar. People are sitting and watching from their comfort and understanding the important part of the organ, which is the heart, and you are saying it so beautifully. Doctor, we are almost at 40 minutes, and thank you so much. But there's one more question that's always I want to, ask, and also to benefit a lot of other people as well. If you have noticed, or I have noticed, a lot of times, maybe I would say about 30 or 40% of the time, someone is exercising and the chances of MI is higher, especially if you have high risk factors and all that. If you have not done the marathon, if you have not done that exercise, he might stay alive. But because he exercised and he got a heart attack, is it because of the issues? Is it because of that we talked about all that? Is that could be the risk factors that brought him to that stage and the heart went into a stress mode?
That's a fantastic question with, unfortunately, a very complicated answer. When you exercise, and you know that, if you exercise regularly, over time, you train your body and your system to reduce your risk over a prolonged period of time. So if you exercise regularly, you reduce your long-term risk, right? The problem is, while you're exercising, your risk is actually higher during that activity, because once again, we go back to the idea of stress. If you put stress on a body while you're exercising, you increase the risk at that point in time. Now, that risk might be for a very healthy person, 1 in 100,000. But we often quote that when people go and do a treadmill stress test in a clinic, we quote a 1 in 1,000 risk of having a problem. Now, if you extrapolate that into every time you go for a run, okay, you have that 1 in 1,000 risk when you're exercising. So the idea is to make sure that your risk is low before you exercise. And that's where the regular checks come in. Now, going and running a marathon puts your heart under a lot of stress, okay? The actual distance of the marathon, the 42 kilometers, comes from the Greek stories. The first guy who ran that distance from the city of Marathon and to warn them about the Persians was Phidippides. And he ran the 42 kilometers, told them Persians are coming, and died. Do you remember that story?
Yeah.
There's a story. The first guy who ever did the marathon distance that is recorded died doing it. And that's the problem. If you're not trained to do it and you've not checked before you do it, that's where the risk comes in. And that's why athletes, especially professional athletes like footballers, they go through different tests from everybody else, even in their teens and 20s. You get an ultrasound scan, an echo. I'm involved with Singapore football, by the way. I don't know if you know that. So anyway, so for the professional players, we have special tests that are different from the rest of them because they are functioning at a higher level and are at an increased risk. So if you've got an abnormality that's undetected, then for sure your risk is higher. And the problem is the first time you detect it might be the time when that particular person collapses. And that's why the checks need to be there. So the higher the intensity of your exercise, the higher the, or rather the greater the distance you need to run, or the heavier the weight that you need to carry, right? The more extensive the tests need to be done beforehand, very often. And as I said, I mentioned the example of this guy who was running marathons. at the age of 50 and found out that he'd been doing it with 100% block, and he trained himself to overcome it. We fixed his arteries, by the way. We stented. Everything is good. He's getting better times once again. I hope that explains a bit as well. I know I tend to extrapolate a little bit. Every time you ask me a question, I answer too.
Yes, because I do agree, doctor, because there can never be a accurate answer, because science and the medical, it just keep on evolving. Like you have explained it so beautifully, so simply for everyone to understand. There's always also a risk for me, because most of the time when I train my clients, because we involve raising up the heart rate to a certain level, like 60% of your maximum heart rate, 70% of your maximum heart rate. We always monitor that. Sometimes those who wear a Polar watch, particular a heart rate monitor watch, or we even calculate 10 seconds of the beat and then times it by 6, so we know the average heart rate, looking at them, whether they're perspiring, looking at their posture, looking at their recovery. So it's very detailed that a fitness professional have to put in. But also saying that, it's also very important and very crucial that anyone before want to start an exercise program have to get a green light from a doctor first before starting up an exercise program. They cannot just jump up and say, we're going to run or going to exercise, because that's the higher risk. So usually when someone comes to me and say, want to start training, first I look at their profile. And if I see something that's not right, smoking, drinking, eating unhealthy, overweight, the risk factors just increases. I do not want to take the risk, because I want to make sure that that particular person stays safe and get their results and live happily and live longer. I think that is a responsibility that the fitness professionals should take at this point of time, because with so much of issues coming up at this period, especially with people, a lot of emotional stress, mental stress, physical stress, and then challenging period right now, doctor.
No, of course, and that's where experience counts. And an experienced trainer like yourself would be able to identify these things as soon as the guy walks in the door. Same thing with a doctor. Over years, you start to identify the issues as soon as they walk in the door, when you've seen enough people doing that, and that's why it is also important to have supervised sessions if possible, especially if you've not been exercising and you want to start, you're in your 40s and you decide, okay, now I'm going to do this stuff. And actually the scariest ones are actually the weekend warriors, where they go in and they really, they push it to the limit. Yeah. 1 day a week at the weekend, playing football like crazy. These are the guys, okay, who are at higher risk, and they need to find a balance between doing that, having themselves checked, and also exercising more regularly.
It's also because, doctor, just as to carry on with what you just said about, it's a kind of accomplishment they get. Oh, I'm exercising once a week. I feel good. I feel perspired. But then when they come back to the work life, it's like Monday to Friday working so hard, and then Saturday. So it's the risk factors is so much high. Anything can just happen at any time. So with that, I think it's very, very crucial that everybody should be taking care of their health. That is the most valuable and priceless that everyone should focus on.
Yes, I agree.
Thank you so much, doctor, for spending almost 50 minutes. And to be very honest, there's so many questions that's coming in, but I can't let you take so many of these questions, because it's more than what we have agreed for with your valuable time, and you need rest.
I'm happy to spend the time doing this anytime, my friend.
Thank you so much, doctor. Doctor, before we end this great conversation I had with you, it's my true blessing. Is there something that you want to give some advice or tips, as we call you the angel, all doctors and nurses, they are someone special, because I'm very sure every time when you save someone, it's some kind of fulfillment or the happiness, because I do get it when someone gets results and say, oh, I look good, I'm fit and healthier. I get that, but you are saving someone's life. Doctors are saving someone's life. They should get like, wow, the kind of experience that you feel is amazing, right?
It is, and I think, I feel very privileged that I have the opportunity to do this. Not everyone gets a chance, and I'm glad that I get the chance to do something that makes a difference for people's lives, like what you do and like what a lot of other people do. Saving lives is important. Making sure that the quality of life is extended for as many years as possible, as many good years as possible, is very important as well. And this is what we strive for on our side, yourself in the fitness industry, a master trainer like yourself as well. And my advice to everybody, God, I could go on for another hour perhaps, and that would bore everyone. But basically, take good care of yourself. Make sure that if you need to get checked, you do. Don't be afraid of going to see the doctor. They're your friend. They're trying to help you. All right. And if you have questions, you should be able to ask your doctor. If you're found to have blockages, which is the most common problem for heart disease, don't be afraid to take the medicines, because there's a lot of noise out there on the internet. And the problem is a lot of the information that you read on the internet is not vetted. I would go with society guidelines. And when my patients ask me, but doctor, I heard that cholesterol tablets are bad for you. Okay, you got blocks in your heart arteries. You take a cholesterol tablet, you reduce that risk by 50% straight off the bat, just like that, But you don't want to take it because someone said, oh, this is going to be bad for you. And we see so many patients coming through our doors not taking their medicine. So if you've got difficulty with the information that was given to you, I would suggest, okay, go and get a second opinion from another doctor if you need to. Okay, it's okay. Us doctors, we're very happy. I tell my patients, please, if you want to, go and get another opinion of someone else. Okay, and usually they will tell you the same. And when someone comes to me for a second opinion, I tend to send them back to the original doctor and tell them, look, that guy's told you the correct thing. I'll show them that the literature and the guidelines, there's European, there's American guidelines showing that you should take your medicine if you have a particular problem, and it saves your life. But the problem is many people don't want to be patients, right? So they say, doc, I don't want to have diabetes. It's very easy to say, I don't want to have diabetes when you already have it. And then after that, you don't take the medicines and you pay the price because diabetes is one of the risk factors for heart disease, right? So then you need to take the medicines if you need to. And that's what's going to save your life. So work with your doctor, work with your trainer, work with the information that you have available to you, and be aware that if you've got a condition that requires medication, and if your doctor tells you to take it, more than likely, okay, you should continue doing so. Or rather, you should continue doing so. Very important. That's how we save lives. Thank you.
Thank you, doctor. I mean, I got to be very thankful for this opportunity because I think it's a very interesting topic. It can just go on and on and on. And I think with your expertise and the humble way of explaining in the simplest way, it's very easy to understand. It's very easy to understand, and they should know because this is our operating manual of a human body. So if they know that, then they know how they can make it into a best performance. So once again, thank you so much, doctor, for this time. And the topic on the heart matters a lot. So thank you, doctor. We will get connected and we will speak more after this conversation.
Thank you, Van. Thanks everyone for watching this. Thank you.
Thank you so much.
Bye now.